talk a little bit about how to reconnect back into that passion that may have drew you into medicine, and then further from there drew you towards integrative medicine. And in that, it helps us to sort of look at the thoughts, the ideas, the principles that may be holding us back from really shining and build a momentum in towards sustainable practice styles. And this is also a lead up in a little, you could say, a preview of an upcoming podcast where I'm going to be interviewing so many people about all the principles of lifestyle medicine and integrative medicine that they've been integrating into their practices and on their own journey. So I hope you'll tune in. We'll be about 20 minutes, not too long. And I think that this is something that we're really excited about to share and to bring forward. And of course, there may be some technical issues, and always getting the mic situated is part of them. But again, hey, that's the journey, and it's a perfect segue into this principle of, you could say, progress over perfection. So this has been a big part of my unlearning in integrative medicine, is that sometimes there's progress, but we don't want to confuse, movement with momentum and forward action. We can be really busy multitasking ourselves and trying to create these new practices and innovate in our systems, but still not seeing practice innovation truly coming to pass. And in the process of that, burning ourselves out a little bit. So I want you, even just in this moment, to remember what brought you to medicine. I remember for me, I had a dream when I was in the 7th grade, and it was this very persuasive dream that said, I want to take you on this path of healing and learning. And by the way, you're going to be invited to that same path. So in this moment, even just take, if you're driving, don't do this, but close your eyes and just think back and remember to what those moments were that gave your original joy in thinking about being as a support or a mentor or coach or a guide to people in their healing journey. And I want you to just hold that vision within yourself as we're kind of talking about this through this live event. Again, I'm Dr. Siri Chand, and I'm an internist board certified in integrative and lifestyle medicine. And I'm hopping on this live to share with you about World Integrative Health Day. And if you're joining me, just tell me where you're joining from, and let's make some connections and see who's out there in the world together with us. Now, as we're sort of making these transformations, I have to say that one of the reasons I want to do this and jump in here is that in my coaching practice, which I actually don't talk that much about in mentoring, I really have found that these small mindset shifts actually make a big jump for people in their ability to have transformations as they're innovating in their practice. So this is important to recognize. And I think when we actually think about this, I always use the analogy of, you can be driving on the Autobahn or you can be driving on I-95, right? But if you've taken the same car from one location to the next and you're still driving in the same way, the location, the external pieces of it may be a little bit different. But if you're still driving the same way within it, it's not going to really lead you to the success you want. So again, this webinar or live event is really an invitation for you within yourself to remember that as you embark into the fields of integrative medicine, there's incredible value in honoring within yourself that there's healing, unlearning, decolonizing from paradigms that have been persistently present throughout your entire career. But I would also say that your dreams are valid and within reach. And so it's small, consistent steps with clarity that make all the difference. Now, first and foremost, I have to remind you that if you're experiencing any burnout, 100% not your fault. There are so many systemic issues in healthcare that lead to burnout, the least of which are your personal beliefs that healing sits in a different methodology, a different system, a different way than the system that you grew up in, so to speak. Maybe you embrace time in nature to help reset. Maybe you're very focused on helping people learn about sources of trauma and how trauma has impacted them. Maybe you're very interested in understanding the roots of botanical medicine or even energy medicine. Maybe you believe in contemplative work or journaling or art and creativity, all as pathways that help re empower an individual to lead themselves into better informed healthcare decisions. This is different per se than saying to someone, journal this article, or no, sit down and journal every morning and you'll heal your cancer. That's not what I'm saying. What I'm saying is there are a lot of ancillary decisions when someone is undergoing cancer treatment that require them to show up for themselves, creating community, organizing meals that nourish themselves. And I know this from my years in hospice work, which I did for a long time. So just using that as an analogy, but just understanding that that empowerment model helps build this cohesion within someone's belief system that they have agency. But that takes time, that takes energy, and that takes building relationship, which often for integrative physicians is a key component of the healing journey with someone. I always like to call it the therapeutic elements of our relationship. But remember that we don't have to do it perfectly. Progress over perfection. You're probably gonna hear me say that a bunch over the coming years, because I see the deep and intrinsic value of appreciating that when we're integrating integrative concepts into our practice, we're thinking about it like, I have to be extremely perfect in this. I can't miswrite a prescription. I can't operate on the wrong part of someone's body, wrong side. But fundamentally, what's fun about integrative medicine is that there's room for exploration. There's room for enjoying how that process works with people. And there aren't, in the same way, wrong answers. If we look at the pillars of lifestyle medicine, movement, stress reduction, sleep, whole food, plant-based eating, plant-forward eating, you might think, oh gosh, it's a lot of energy for me to figure out which one to talk to them about first. There may not really be a wrong answer there. It can be a constant garden that you're tending together with them. And these are things that I think can help us reframe our model of success and recognize that also we don't want to compare our model of success with what someone else is doing in the field. Integrative medicine allows people to have very vast and different practice ideals. Someone might be doing survivorship after cancer using an integrative medicine model. Another person might be working with the elderly or in longevity. Another person might have a focus in metabolic syndrome or autoimmune conditions or long COVID, kind of like what I've been dealing. So recognize that our struggles, our questioning, these things are not our weaknesses. They're part of our own journey that we can embrace. And I think this is important to recognize progress over perfection. I'm going to say that 5 times with me, right? Progress over perfection. So your struggles aren't your weaknesses. And often, even when I was young in my career, there was so much stigma around getting support or help. And I'm so grateful to say that I feel like the culture of that is really shifting and changing. Now, a couple of things that we're going to go through a couple more points. One thing that comes up a lot in integrative medicine careers is that there are going to be people around you that are very critical or very judgmental. They're going to say, why are you studying yoga? Why are you studying mindfulness? There's no evidence for that. Why would you take 2 years off to study abroad in a whole person healing system? Or why are you interested in psychedelic medicine or ceremony? These things don't have a place in the traditional healing that we learned in our medical school and residency. But I want to reframe this and recognize that sometimes these arcs are also part of our own healing journey. And when we begin to translate that, our radiance, our health, our inner clarity begins to be part of our own marketing to help the people that are inherently having a hard time connecting to what we're doing. And part of this is not being paternalistic in it and appreciating that people have many different pathways that help them in healing. Now, curing is kind of a different conversation and takes place more concretely in a therapeutic relationship. Healing is this lifelong trajectory where we're constantly in a sort of inner inventory of what is my daily routine? How are things changing or shifting that I want to pay attention to? So take care of your own inner ecosystem. Recognize that your health, your joy, your patient's outcomes can in time speak to some of the criticism. The other thing is, and this is a little bit more popular these days, this phrase is let them be critical. In fact, I think it's important to have a scientific inquiry and question about how you're approaching and thinking about things. It is not always easy for us to have a study off the top of our head, especially if we've moved a bit from our head into our heart, so to speak, metaphorically. We may not have that razor precision of XYZ study published in XYZ journal demonstrating XYZ procedure, therapeutic option, botanical, nutritional intervention, exercise intervention, sleep intervention had this outcome. It's okay to say, I appreciate and hear your criticism. Let me ask you a specific question. Encourage curiosity in them. But this is something that we want to recognize that in integrative medicine, we can confidently say we're utilizing therapeutic interventions that are evidence informed. We're not just ordering expensive labs and expensive supplements. Integrative medicine is fundamentally so much more of that. And if you're just tuning in, I'm Dr. Siri Chand. I'm an internist board certified in integrative and lifestyle medicine, and I'm sharing a bit about the inner world and care for particularly women in integrative medicine on World Integrative Health Day, where typically we might think about the practice towards the patients. But today I want to take that lens a little bit into ourselves. And if you're just joining me, leave your name, tell me where you're joining from, and I'll circle back to look at some of the comments and say hi to you. Now, there's a common myth that often comes about here, and I'm going to just call it the work-life balance myth, okay? I actually don't think there's such thing as work-life balance, particularly for more empathic doctors who are thinking and feeling deeply from what's happening around them. You do think about your patients, and even if you redirect your mind outside of a clinical situation, your mind does linger in it. It's a myth to think about this separation and segregation of our life experience. Life is happening. But we can think about integration and embracing that and finding my personal favorite is remember that you need to be on the calendar. Now, we have all these crazy schedules 15-minute visits, 30-minute visits, and if we're really fortunate, 60 to 90-minute visits. But where are you on the calendar? That's something I really want you to think about and give thought to. And if you're interested in having all of this kind of in a document, I do have something I've put together for you to help transform some of these critical inner thoughts to give you that life and practice of joy that you want and frankly deserve. So just put myths of integrative medicine in the chat and I'll be sure to send you that information. At any rate, there are a lot of priorities in the healthcare systems that exist outside of you and frankly don't have your well-being at interest. And physician well-being is a bit of a buzzword. It's very expensive to onboard and train new physicians into practices. There are teams that have to get the credentialing and the panels and the patients. So practices don't fundamentally want to lose physicians. But at this point in time, the entrance of a profit-driven model into medicine fundamentally is opposed to how the integrative physicians tend to view things, which is an investment in relationship, which generally requires time. So just understanding that you exist in a system that inherently is not favorable to your philosophy. It's kind of like, do we fight that or accept that? And if we're going to fight that, how much energy does that take? And is change actually possible? In some systems it is, and unfortunately in some systems it isn't. So this is pretty unfair. And I think, perhaps I'm biased, that sometimes female physicians in practices find themselves holding the panel of in the integrative lane of the most complex patients in a practice, because they're the ones that are often willing to go the distance, make changes, learn about behavioral changes, learn about nutritional changes, sleep changes, circadian rhythm, microbiome, all those pieces. So it can be a little bit not to your favor. So it's important to look at those barriers to success. But unfortunately, what happens is that a lot of integrative physicians become busier and busier and busier in their practice. They don't actually put themselves back on the calendar. And there's some great programs for charting better, but this still doesn't get to the root of some of the issues that integrative physicians feel, which is there's a fundamental arm of education that's part of how we deliver care. Even you could say a coaching. But we have to put ourselves back on the calendar. Even if it's just an hour a week, 2 hours a week, half hour a day, where on the calendar, where on the schedule are you showing up for yourself? And in that time, it can be things that are completely unconnected to medicine. And we've created a community where all that content of what to do in that time has been curated for you. And I'm happy to share more about that. You can check out vishuddha.com, vishuddha.com. And you'll see all the content we're creating so that you don't have to think about what to do in those times that you have free. And it's important, even if you don't think about it on a daily basis, recognize that monthly, weekly, daily, there has to be moments that you honor the things that you need. Time to use the bathroom, time to chew your food, time to talk to your best friend, time to be with your partner and be in situations that are cozy and relaxed. It's time to put the phone down. It's time, right? But if we're not consciously making that decision, it's not going to happen. So, just summarizing a few of our points: progress over perfection. Let the criticism exist. Let your presence speak louder than an argument, and let people learn over time from you with curiosity. And the one we just sort of looked at, recognize that the system is not inherently looking to your well-being, so it's up to you to do that, which is ironic because here we are serving others to stay healthy and balanced. And in our last 10 minutes, I'm going to just go through two more points. So one is, we're still working a little bit on this work-life balance, but one of the things that makes that balance point hard, particularly for integrative physicians, is that we kind of want to be able to do it all, right? We want to have that beautiful practice model. We want to have that integrative approach in our life and in our families. We want health and healing for our relatives and friends. And we're educating everyone everywhere. And at some point in time, we end up sort of being the generalized helper. We're very empathic, we're good listeners, and we're carrying a unique set of knowledge that people are often very interested in. But recognize within that, you yourself also need boundaries and clarity about when you're in service to a person, a situation. And this is something we forget, right? We think, I'm just going to keep showing up. I can keep serving. I can keep providing value. But as we do that, our tank gets lower and lower. Our energy gets lower and lower. And we need reserves. We have to drink from the same water, the same wellspring that we wish for everyone else. So there are some unfair pressures, of course, that show up as we become so knowledgeable and so much desiring to be of help and support to others. But just recognize in that, catch yourself when you feel your energy low and someone says, hey, I have a question. You could say, and a no is a full answer. This is not the right time for me. I appreciate your question or your concern if this is a family member and you do want to support them. Can we talk about this at another time? Sometimes even practicing your no can make a big difference. So one other last piece that I want to talk about is that sometimes for people in integrative medicine, there's a non-clinical path that begins to emerge that's more oriented towards entrepreneurship, education, new models of how we deliver care and how things are given to people. And when you're first thinking about that, and this may not apply to everyone, the first thing you can think of is, oh my gosh, I am letting go of this incredible education, and it's going to be harmful to people if I'm not available. And I've wasted my medical education. And I can't tell you, unfortunately, how many times I've heard that said by other women in integrative medicine, but also how many times I heard myself say it, even though my health issues were really primarily preventing me from being able to go back effectively. So there can be this sort of over glorification trap of this culture of busyness, this culture of overworking. And when we pause or step back to reevaluate things and do self-healing, there's so much shame and judgment that we start in our own mind that's just permeating through the culture of medicine. And then if you're really doing that deep healing work, it requires some time and space to allow for yourself to hear those uncomfortable feelings. Who am I if I'm not productive? Am I worthy if I don't carry the same prominence with these degrees and titles that I've earned? These are very vulnerable questions. And I think it's really important to recognize the value and how we show up in that conversation with ourselves. In our counseling, in our family we work with, we always say the story I'm telling myself is. So, your personal well being is one of your most important achievements in your life. And your friends, and certainly your partners, children, parents, will be the first ones to affirm for me what I'm saying. So, recognize that in that busyness, in that deference from what we might be thinking about for ourselves, this is an important and meaningful action to pause and say, I deserve the same health I wish for others. And you don't have to follow the traditional path to make a meaningful impact, right? You don't have to follow the traditional path to make a meaningful impact. I probably could say that 5 times over, just like progress over perfection. So I hope that some of these concepts resonated with you. And if you're joining a bit late, I'm Dr. Siri Chand. I'm an internist, the board certifications in lifestyle and integrative medicine and hospice, but I haven't done that for some time. And I have something today for you based on our conversation. And it's an ebook that's about 8 myths that women in medicine, women physicians really need to unlearn. So you could just put 8 myths in the chat if you're rewatching this, and I'll send you a link on how to get it. And this is tips for helping you realign your internal dialogue and normalizing some of these things that come up as we're on that integrative medicine pathway. There's some strategies to help you let go of societal expectations and find fulfillment, and dare I say, even joy. And I've seen this in the client work that I've done with women who've redefined their success in medicine. So I just want to close by telling you your dreams, your vision are worth pursuing. And it's never too late to align your life with your values. And I am super excited that I had an opportunity to come live with you today on World Integrative Health Day, where classically we might be thinking about the deployment of this model, the integration of this excellent medical model that applies for patients. But also, I wanted to pause and honor and make light and introduce these series that go with the women in medicine that are giving this care, the women that come from traditions of healing, the women that come from internal value of intuition and collaborative care, and also collaboration amongst community. We also have a workshop this weekend from 11 to 3 Pacific time with myself and 3 other wonderful integrative-minded clinicians who are going to take us through a day of rejuvenation, a half-day retreat, learning about these principles of inner alignment, unlearning, creating space, and rest. And I think the best analogy for all of this as I wrap up is imagine right now you have bulbs that you want to plant for beautiful flowers in the spring. And as the new year starts, we're often kind of thinking and planning about what's coming, right? Where am I in the midst of um, my growth cycle? And in the winter months, oftentimes the bulbs show no signs of movement, but they're holding a space of awareness. They're gathering energy. It's a potential time. You might say a pause. But as that potential pause is happening, it's not that nothing is happening. Things are still happening in that internal world, just not as much to the visual eye. And the New Year's resolutions try to kind of get us into a framework of momentum and movement forward. And what I'd like to encourage us to do in this particular season is to gather energy, rest, create expansion, and then think about as the spring emerges how we might bloom with a realignment in that vision and in those ideas. So, if this resonates from you, I will circle back and put the link for the workshop. You can also find it on the Vishuddha homepage. And so if you have any questions, please reach out. Thank you. I am Dr. Siri Chand. I'm an internist, board certified integrative lifestyle medicine, and Ayurveda enthusiast. So thank you so much for joining and coming attractions for our upcoming podcast. You might consider this our preview episode. Take care, everyone, and happy World Integrative Health Day. And I'm going to hang out for a second just to see if there are any questions. And somewhere here, there's an ability to see questions. I think I'll finish up and I'll figure that out another time. I hope everyone has a wonderful day and take care of yourselves.